Hi, everyone. It's real time again with Dr. Melissa Clarke. Thank you so much for joining. As you know, we're on two platforms now, Facebook Live and YouTube. And so we're waiting for all our YouTubers to get into the room, as well as our Facebook family. Welcome once again. It is the day after Memorial Day, so I hope everyone had a safe and healthy Memorial Day weekend, that we honored those who serve our country, and that we also had time to recreate and do those very important self-care activities. I am so happy, though, that you're able to join tonight, Tuesday. Remember, this is a one-time only Tuesday night appearance on Real Talk because we normally are here Monday night at 9 o'clock. We only did this because it was the Memorial Day weekend, the official start to summer. So thanks so much once again for joining us. We are going to be underway in just a couple of minutes. Again, just letting people tune in because we have a great show that is in store for you. As usual, we're going to start with our weekly updates. Then we're going to go to our debunk of the week. And finally, we're going to move into the main segment of the show with our three guests this week. This is the first time we've had three guests, and they are representing different regions of the country as we talk about our children, which I know for many of you who are parents, aunts, uncles, grandparents, it's been weighing on your mind, all the changes that our children have had to go through in adjusting to COVID-19. We as families caring for our children have had to go through adjusting to COVID-19. Concerns about the medical aspects, the psychological and emotional aspects, and of course, the academic aspects. So this episode, we're mainly concerned about, children under 18. We're going to have a special episode devoted to college students later. So bring your questions. I hope you're getting them all ready because we're going to be starting right now. So again, welcome to Real Talk with Dr. Melissa Clarke. And I am going to go ahead and get started with our episode this week with a weekly recap. And as usual, there's a lot to talk about. Well, first of all, I want to talk about the reopening. So, as you know, there have been concerns all weekend about the fact that we're seeing these record crowds in places like boardwalks on the beach, Atlantic City, my hometown, Virginia Beach, as well as block parties that happened in DC with 200 people at a time. And even the Ozarks. I know y'all probably saw that picture of the Ozarks. And, I'm binge watching Ozark on Netflix. I was like, hey, wait a minute. So these things make us wonder, hey, wait a minute. Did these people just not get the memo? Do they not understand what's going on? Did they ever understand, or they just don't care? Or maybe they think that because we're reopening, that means that we're safe. But to the contrary, now more than ever, we need to focus on practicing the behaviors, which include when you're outside, staying physically distant, at least 6 feet apart from other people, wearing masks, not touching your face, using hand sanitizer or washing your hands if water is available, and definitely wearing the mask, which a lot of people question, but we talked about last week. All those myths around masks really go out the window. And we know that they are effective in stopping the spread of the virus. So 18 states are actually increasing in their case counts, the number of people diagnosed with coronavirus. And we're still talking about opening things like nail salons, massage parlors, movie theaters in some of these places. 22 places have stabilized in terms of their case count, and 10 states are actually, thankfully, going down. So as we talk about case counts, let's switch to the numbers because I didn't talk about that. That should have been the very first thing, but let's just go to that now. As we talk about the numbers, we are over 1.7 million cases in the United States. And unfortunately, today I pulled up the page this morning that gives me the counts, up-to-date counts of what's going on. So I pulled it up this morning, but I didn't take the number down until later in the day. And during just that period of time, there were over 135 more deaths. So we now have officially crossed into over 100,000 deaths in the United States. As always, though, I always give you the number of folks who have recovered, which is a beautiful thing. And that's at over 353,000 actually cases of individuals who have recovered from COVID-19. So the next thing I want to talk about is how do we know if if it's safe, for our states to reopen? And one of the criteria, there are actually 4 criteria to look at, and you can kind of get these statistics from your state health department's website or your region's website. So one is, what are the trends for cases? We've talked about the number of cases going down. Well, sometimes that can be a little misleading because confirmed cases is tied to testing. And sometimes labs have delays in testing, and so they batch report their results. So it could look like there's a spike in one-day cases when it's not really a spike. There really should be evened out over several days. So one thing that many public health authorities are relying on are the days that new symptoms started. So they're looking at how many people got symptoms on a given day, and they're using that as their average. And so if you look at that for many public health websites, in some municipalities, it shows that cases are going down. So that's an important thing to look at. The next is, are there enough ICU beds in your community? We've heard in places like Montgomery, Alabama, Minneapolis, Minnesota, that ICU beds are running short and almost down to 0. And certainly that is an index of the healthcare system's capacity to take care of patients. Because if you need an ICU bed and you can't get one, you're not going to be getting the highest quality care there is. So it's really important to also keep your eye on that. And then the other is, what is the R number in your community? So what is an R number? The R number is how many people does one person with the coronavirus infect? Left unchecked with all the measures that we've been doing around the behaviors, that number is somewhere between 2 and 3 people. So for each infected person, that person goes out and infects 2 to 3 people. So that's why you hear them say that the curve grows logarithmically or exponentially as far as spread. But when you're doing the things that we're doing in terms of sheltering in place and following the other behaviors, the goal is to get that number under 1. So less than 1 person on average gets the coronavirus from 1 person. And if you can keep that number under 1 for a sustained period of time, 14 days or greater, you can really help definitely to stop the spread. And so that's a really important number to keep an eye on. And then finally, is testing and contact tracing widely available in your community? So those criteria are the ones that you should be looking at to help determine the next thing we're going to talk about, which is, what are the safe activities to do as we reopen? So first, you kind of get an understanding of, how is my community doing as far as spread? And then when you're comfortable in terms of the amount of spread that's available, that is happening in your community, then you can start to think about, what are some of the safe things that I can do outside? Well, the first thing to know is, what is your risk tolerance? You have to decide for yourself and for the loved ones who you interact with, those people that you live, what risk you're willing to take as far as your own health and as far as their health. So you might make that decision based on your age or based on the underlying conditions that you have or the age or underlying conditions of people that you live with. You might want to look at the level of spread in your community, as I just talked about. And you might want to also take into account your ability to practice the behaviors in whatever setting you're considering doing the activity in. And then, what is the activity? You also have to talk about that. So, the highest risk activities are going to be those that take place inside in a closed setting and in close quarters. So, those include things like getting your hair done, getting your nails done, getting a massage, getting a tattoo, going to a day spa. All those things where people must touch you and be within 6 feet. There's no way to do the service without being within 6 feet of each other. And then you also have to think about bars. Probably not safe. People are drinking alcohol. They're not going to be practicing the behaviors. That's probably not a great place to go. Then you have restaurants and churches. Well, as long as those restaurants and churches are following the CDC criteria or your Department of Health's criteria for reopening and are able to provide that physical distance between folks, masks are being worn, and people are practicing safe behaviors, then it's a little bit less risky in those venues. If they don't provide for any of those things, then that becomes high risk also. And then you want to look at your lower risk activities. Those are things that you can do outside with your family, or if they're with people who don't live in your home, maintaining that 6 foot safe distance. Of course, we talked about outside being safer than inside because there's ventilation, there's the wind, there's the open air to disperse the virus. And so that includes stuff like outdoor exercise, golf. I call that the perfect social distancing sport. Cookouts with 10 people or less who are able to space out more than 6 feet apart and bring their own utensils and bring their own food. So it can be a BYO food and utensils cookout. And you want to minimize your drinking too, because again, when you drink, your judgment gets less and you're more likely to be lapse in terms of the behaviors that you practice. Even a beach can be safe, again, as long as you're staying 6 feet apart from other beach goers who you don't know or who are not in your immediate household. So that's what activities are safe. Now, for the fourth item is the medical progress report. I want to try to keep it balanced. I don't want it to be all negative news, and this is definitely good news. So we in the medical community, we've been at this in the United States now for over 2 months, and we do have a better idea about how to take care of patients with severe COVID-19 than when we started this all. So, for example, we know that blood thinners need to be used immediately when people get to the hospital and are in very severe condition. And so those use of those blood thinners are helping to save lives. In addition to that, the NIH has published specific criteria for the treatment of patients with severe COVID-19. So there's guidance about the use of antivirals like remdesivir, or for things to help the immune system, like using plasma from people who've recovered from COVID-19. And there are other drugs like steroids and other immunoglobulins where there's specific populations that we're honing in on that those things can be of help. The NIH guidance also includes what not to use, like hydroxychloroquine, for example, in high dose. So there's definitely much clearer guidance, and I am optimistic about survival rates going up as we start to improve on the medical care that's given, as well as keep that curve flattened as well as going down so that our healthcare resources don't get overwhelmed. So now I'd like to move to the weekly debunk. And we've been having some good debunk sessions, and this one is going to be no different. So we're going to talk about the president saying that he's taking hydroxychloroquine. Now, I know it seems like that was a long time ago, but it was only a few days ago. And I just wanted to set the record straight on a couple things. I don't know whether the president is taking hydroxychloroquine or not. And frankly, I don't care. I care about you all who are listening getting the right information at the right time. So, as I mentioned before, that expert NIH panel, they recommend against the use of high-dose hydroxychloroquine for the treatment of COVID-19 because higher doses carry that higher risk that you're seeing some studies shut down regarding with the heart complications. And several trials have closed down as a result of that. There is an FDA warning that says that hydroxychloroquine and chloroquine should not be used for COVID-19 outside of a hospital setting or of a clinical trial. So unless you're willing to be in a clinical trial, then you shouldn't be taking hydroxychloroquine. Now, it is an important distinction, which I haven't heard a lot in the media, that there is a difference between using hydroxychloroquine to treat COVID-19 versus using it prophylactically in a healthy person to prevent COVID-19, which is what the individual in the White House was talking about. And so, again, there are clinical trials going on looking at that, and they are happening in healthcare workers. However, those clinical trials are not concluded. There is not even any preliminary results yet. So as far as recommendations are concerned, there is absolutely no recommendation to use hydroxychloroquine for anything outside of a clinical trial. So that's our weekly debunk for this week, May 26th. So now I wanted to go to what many people have been asking us over the past 10 weeks that we've been doing this, and that's what about our children? We've gotten several questions here and there about children. So I thought it would be important to devote an entire episode to it. And it's really concerning the physical well-being of children, their emotional well-being, and their academic well-being. So I wanted to first start off with the medical. Early on, we said that children were unlikely to have acute symptoms from COVID-19, and that still holds true. We see acute symptoms from COVID-19 increasing with increasing age groups. And again, individuals over 60 seem to have the worst manifestations, or individuals with underlying health conditions at any age. But again, older age, middle age and up, that seems to be the worst. However, we've now gained an understanding of something called the multisystem inflammatory syndrome, which seems to happen in children 2 to 6 weeks after they are infected with COVID-19. So that's why I said the symptoms don't appear to coincide with the same time children get infected, but they seem to happen 2 to 6 weeks after. And what do those symptoms look like? Well, it's marked by high fever, neck pain, abdominal pain, diarrhea, rash, and what's called a strawberry tongue, a red tongue with little indentations in it, pale indentation. Also, bloodshot eyes are sometimes seen, and sometimes a child will just seem more tired and more fatigued than usual. And there are cases now in 26 states, and over 350 cases have been reported throughout the United States. About half of those are in New York. And it's important to know that if your child has any of those, has a fever and any of those constellation of symptoms, you should seek help from your pediatrician. If they're having any emergency signs, those include things like problems breathing, severe chest and abdominal pain that's not going away, confusion or increased sleepiness where you just they can't stay awake. All those are reasons to go immediately to the emergency department. So those are some of the medical considerations, and I'm going to be happy to take any questions about those medical ones. But we know that children are more than just their bodies. Their emotional and psychological well-being is important for their development, as well as their academic well-being is important for their development. So to that end, I am so happy to welcome 3 guests tonight. Our first guest is Wendy McCulley. She is the Executive Director of the Office of African American Academic Acceleration in California, California's 3rd largest school district. She leverages her previous experience in corporate roles, such as Chief Business Development Officer at Life Alert and Vice President of Marketing at TransUnion, for a results-oriented approach to closing the academic achievement gap for vulnerable students. Welcome, Wendy. So happy to have you.
Thank you, Melissa. Thank you for having me.
Our next guest is Byron Kellam. He's a licensed professional counselor in the state of Georgia. He holds a master's in counseling, is a certified anger management specialist, and holds certifications in school counseling and educational leadership. He has extensive experience in an Atlanta metro area county school system, as well as he has his own private practice, Byron Kellam Associates. Welcome, Byron.
Thank you.
And then last but not least, we have Nardos King PhD. Dr. King has 25 plus years as an educator under her belt, with a demonstrated history of working in the primary and secondary educational school system. She now serves as an assistant superintendent in a large district in Northern Virginia, large school district in Northern Virginia. She is also president-elect of the National Alliance of Black School Educators. Welcome, Dr. King.
Thank you. Glad to be here.
All right, so I need to make an important disclaimer. The views expressed tonight on Real Talk with Dr. Melissa Clarke by our guests do not represent those of their school districts. So that's important to keep in mind. So I just want to start off with a round of questions for each of you. And then we will go to our audience to see if they have questions. So I hope everybody is getting their questions ready and typing them in. So, Dr. King, I wanted to start off by asking, the CDC made some recommendations today about the safe reopening of schools and that criteria. Do you think that our schools will be reopening in the fall versus being on a distance format? And do you think those CDC recommendations are realistic?
So I can't say that schools are going to open in the fall because day to day, science changes and information changes. But what I can say is that districts around the country are working on a plan for if school were to open. I know in my district, we are working on 3 scenarios. One, if we have to continue distance learning and what that will look like, how we can beef that up, because obviously there was no playbook when we stopped school on March 13th. How will we look at school if we do a hybrid model where we bring in students at a 50% or less, and maybe bring in our most neediest students in? And then finally, how do we address people who are not capable of going back to work or parents who do not feel safe in sending their kids back to work? So to answer your question, right now, I don't believe that school systems can realistically answer that question. I know that everybody's hopeful that kids will return to school in the fall. But, based on the guidelines and what the CDC is recommending, it's going to be very, very difficult to do the things that they're saying, because we have been teaching children for a very long time the behaviors that we have to now unteach: collaboration, sharing, being kind to one another. All of that comes with behavior change. And we need time to be able to talk to our kids, train our adults in there. So right now, the answer is, I don't know.
Wow. Well, I think that was an excellent summary, though, because I think it's important to know what are some of the considerations and what children are missing in their development by, having distance learning versus learning in a physical classroom with other students. So
Correct.
to that end, Byron, I wanted to bring you into the conversation. We talked about, those important developmental aspects. What are some of the situations that you've had to be involved in as a direct result of the coronavirus and the adjustments that children and their families are having to make?
Well, first of all, let me thank you, Dr. Clarke, for all the hard work that you do on a weekly basis to keep our community informed. It really goes beyond the pale in terms of getting that information out to people that normally would not have access to it. So thank you.
Thank you.
I'm going to be honest. Our kids are really, really hemorrhaging emotionally and psychologically right now. This thing came out of nowhere, and our kids had to literally grab their things like like it was a fire drill at the end of the school day. And they thought that they would be back in a matter of, days or even weeks. That never happened.
Yeah.
And what a lot of people don't realize is that the school is more than just a source of academics. That's where kids get their love. That's where some of them get the bulk of the food that they receive on a weekly basis.
Yeah.
And that has really been a challenge in the district that I work. We had a program that served, we are 100% free and reduced lunch. And we had 100 families that were even beyond what the regular student in that school, the needs of, the food needs. And so we had a program where those kids were getting extra food. And when this ended, there was a panic. And so luckily our community faith-based partners stepped up, and I was able to continue to facilitate that program for our kids. But that basic need is being neglected. Additionally, our parents are having to become teachers on the spot.
Yeah.
And, a lot of times people underestimate how difficult it is to facilitate learning in an academic environment.
Mm-hmm.
They are learning firsthand all of the challenges that educators have on a daily basis. And I mean, I've gotten so many calls and emails from parents like, man, look, what do we need to do?
Yeah.
Y'all need raises, all this, all these things.
Yeah.
And so, so that's I guess a benefit in all of this. Educators are becoming more valued, in this process. But, so parents are becoming frustrated, and the kids are struggling to meet those academic expectations, even though they've been somewhat lowered to adjust to what we did not know was coming. But they're still, challenged in that regard, and consequently, we've had an increase in domestic issues. I was meeting with a family that I treat the other day, and the environment had become very stressful, and they had to take their child to the doctor to address some other issues. The doctor was in tears because they had to make a report to defects because there was a bruise on the child. And everybody is hyper vigilant, during this time to make sure that kids' needs are being met because of the increase in abuse cases within the homes. So there are just a lot of stressors, a lot of different challenges. And then lastly, the kids were traumatized by the fact that they don't know what's next. A lot of their parents are out there as essential workers, interfacing with the public. No one knows who may be carrying the virus, so they're scared that their parents may not only contract it, but may die. I've had a guardian of one of my students to perish, and that's traumatizing.
Absolutely.
Additionally, what a lot of people don't realize is in our community, grandparents are a major support.
Yes.
A lot of them are the primary guardians.
That's right.
They've been forced to isolate themselves from those kids. That was an additional source of love and support that kid has that they no longer have access to. So these are some of the challenges that we've been faced with in terms of trying to support our students and my clients, families during this trying time.
Wow. Well, that is an excellent overview, and you brought up a number of points, but I want to also bring Wendy into the conversation as well. I know, Wendy, your focus in your school district is specifically on African-American children. What are some of the additional challenges that you've seen? And I know your focus is academics. So whatever standpoint you'd like to speak from around the challenges presented by the pandemic.
Well, one of the main challenges, and that's a great question, Melissa, is learning loss. We know that our lower income students lose at least 3 months over the summer. They don't have the same advantages, the same opportunities as some of the higher incomes. And we don't know what this is going to produce in terms of learning loss, because our teachers are learning how to teach distant learning and remotely. So they're having to ramp up on professional development. And our students didn't have the devices and the mobile hotspots. So we're trying to get those out to them too. So there's been a major gap in their learning. So in addition to the 3 months over the summer, Jeffrey Canada from the Harlan Children's Zone thinks there's going to be at least another 3 months. So that's 6 months of learning loss. Kids will be behind. Kids who are already behind will be further behind. And so that is our major concern. How do we make that up this summer virtually? Because we are in my district doing a reading program for African-American kids, 700 virtually. And it has a component where we also teach the parents how to teach the kids how to read, because we need the parents to understand and support them at home. And this will be good too, because as Dr. King said, we're not sure what school is going to look like next year, or how we're going to be going back, or what supports we're going to be offering. So the more we can equip parents with the supports that they need for their kids, but that's really it. We're really concerned about where our kids will be next year after this pandemic.
Absolutely. Well, I still have some questions for you, but I want to make sure that everyone has a chance who's listening to get their questions answered, because I could talk to y'all off camera anytime. So can we go and see if there are any questions from the audience so far?
There's a question for Byron. Any tips for parents to manage their homeschooling fatigue and well-being, especially if the children aren't allowed to return to school?
Wow, that's a great question. Well, first and foremost, as we enter the summer months, I think it's most important that you give your kids opportunities to do things other than school. They were hit with a lot of pressure. I know that we did in our district to really try to get our students to complete a certain amount of work. So now they need some reprieve. I like what Melissa referenced earlier, Dr. Clarke, referenced earlier in regards to creating opportunities for social interaction. What we don't realize is that a huge part of the educational process is that social interaction, and our students are missing that contact with their peers. So if you can create a structured play date where not more than 10 people, where they bring their own toys or activities, bring their own food, and just have that opportunity to interact with one another, I think that would be good. As it relates to enriching them, there are a lot of resources online. I would suggest that you reach out to your individual schools, because they have a plethora of resources that they've already coordinated strategically to help supplement and enrich and remediate to make sure that your child's needs are met. So that's where I would start.
Great suggestions.
We have another question. Since the disease is showing up with different symptoms for children, why are they not required to wear a mask under a certain age?
That's an excellent question. Part of it has to do, I know the requirements, first of all, children under the age of 2 cannot wear masks because they can't remove them for themselves. Then children, I think in some areas they're saying under 10. I know in Virginia. I'm going to be honest with you. I'll have to look that up to specifically understand why Virginia has chosen for 10 for the mandatory mask cutoff age. I don't think they're saying that they shouldn't wear them, but as far as it being mandatory, it's not mandatory for children under 10 in Virginia and some other municipalities. But 2 is really the age under which, for medical reasons, they should not be wearing them because of the airway issues and the ability, if they're having problems breathing, to remove it for themselves.
This message comes from Sharon Mack. It's for all or any panelists. How has this impacted planning for summer school sessions? When will it be decided if students in your areas will go back safely in the fall?
Would you like to take that first, Dr. King, and then we could just go around?
Sure, I'll start. I know in my district, we are planning to present something to the school board on June 15th based on a group of a task force members that are working diligently to come up with responding to 3 different scenarios. Then the school board is going to have to decide based on the science and working very, very closely with the health department in our district. We are working hand in hand with them to make sure that we are making the best decisions. So that decision will be made with the 3 scenarios answered as soon as we're capable of doing so in the guidance of the health department. And one thing that I would like to go back on, Melissa, on when you talked about the mask, and the tip that Byron gave, I think that, parents should really work on the social emotional aspects of their kids over the summer, right? Because they've been traumatized, whether you're, come from a wealthy family or, a family that struggles, all kids are traumatized by what happened. And I think that we as a collective community need to make sure that our kids are ready to receive whatever we put in front of them. So we need to focus on that. And teaching your kid how to wear a mask is going to be part of that, because if they go back to school in the fall, they're going to have to wear the mask, particularly the younger ones, because if the CDC is saying that everybody over the age of 2 needs to wear a mask, imagine a preschool class with 3 and 4-year-olds in there trying to wear a mask every day and, not touching each other. These are the kinds of behaviors that I think parents should focus on teaching their kids over the summer. And the academics will come. We know that our kids are going to be behind. School systems are planning on that. But, after what our kids went through this summer, if you have your kids read every day and make sure that they are doing creative activities to stimulate their brain, they're going to be okay to receive the learning that we're going to put in front of them. But if you don't address the social emotional aspect of your kids, then they're not going to be available to receive that.
Excellent points. I would also say teaching them the importance of physical distancing, because we as human beings, our natural inclination is to touch and to be close. And that's even more difficult, I think, to explain to children. So right. I would also add to that curriculum mask wearing and physical distancing. Wendy, would you like to take that last question too? Yeah,
thank you. We are planning for summer school virtually. So we have 74,000 students. We're going to have the core like credit recovery, math, science, and reading. And then we have enrichment for other students. About 15,000 students will go through those core, and then the other students will all have enrichment opportunities online. And in the fall, we're looking, as Dr. King said, there's so many variables, but we're doing surveys to our parents and community. And then we will be looking at the different, do we bring kids back on alternate days, AM, PM? What happens if a kid is sick? Do we have the space to put them into an isolation room so that they are safe and not affecting or not being infected by other students? So it's a lot of variables. School lunches, how do we then feed them and take care of their socialization needs? How do we transport them in school buses? So a lot of factors that we're looking at in our district now.
And Melissa, I would like to add, our school district, we're having 2 sessions of summer school. Our first session is completely remote learning. Our second session will encompass a hybrid model where they'll come to school on certain days, and then they'll learn remotely on others to kind of create that, meet those guidelines for social distancing.
Okay.
As it relates to the fall, we're planning for multiple options, but we'll have more clarity around the 1st of July in terms of what direction we'll be going in. But I do want to go back to what the good doctor said moments ago about addressing the social emotional aspect of this. We, in the school that I work at, we recently secured a COVID-19 grant from the state. And essentially what that is addressing is the trauma that not only our kids have endured, not only have our parents endured, but that our teachers have endured, and our surrounding community.
Wow.
So that grant is going to allow us to do some professional development where we help our teachers deal with the trauma
Excellent.
by incorporating some community partners, as well as, of course, instructing and assisting our students with dealing with the stresses and the anxieties that they inherently will have and do have as a result of this pandemic. So I would encourage my colleagues on the panel to make it a priority to invest some money in a social emotional learning activity or platform, so that not only your students will be refreshed emotionally, but that your teachers will be as well.
That's great. Where did the grant come from? Could you mention that?
From
the state of Georgia. Okay.
Yes. We were one
Fantastic.
of 10 recipients to receive that grant.
Congratulations. That's wonderful.
We have a question from Tracy Lydia Brown. Dr. King, while the students are doing distant learning, are letter grades being given to the students, or is it going to be pass or fail?
Right. So in our district, when we shut down on March 13th, moving forward, we did not give letter grades or that counted. Let me put it that way. Teachers were assessing students and giving feedback on the work that they were doing, but their grades were going to be calculated based on the first 3 quarters of the school year. And because for equity reasons, we could not possibly compare and give students the same kind of work that they had when they were coming to school every day, because we still have families that did not have access to the internet. It took us a while to make sure that every student had some kind of device in their hands so that they could participate in learning. So, and the governor had mandated that in the state of Virginia as well. So all school systems in the state of Virginia were under that mandate. Okay. So thank you for that, sister. That was my sister.
Hi, sister.
We have a question for Dr. Melissa. New mothers, and this is from West Coast, new mothers are especially fearful of traveling to the hospital with newborns. How can they safely visit for shots and etc.?
So I would really encourage you to arrange any visits directly with a pediatrician who has a private office. Many concerns you can get taken care of by telemedicine and telehealth. And then when you have to take your newborn in for vaccines, it can be done in the office setting. And medical offices are arranging themselves such that you can wait in the car until it's your turn to see the doctor. They've made arrangements with their waiting room. They're disinfecting. So I would say that the office is a safer place. Even if the office is a part of a hospital complex, doctors are really going above and beyond to ensure that their patients are staying safe, as well as their staff. And it's very important to stay on that immunization schedule. I've also seen some pediatrician offices that are going mobile. So they're actually delivering vaccinations in mobile vans. So that might be another option that you look into in your community through your health department, or also through your doctor's office to see if a home visit is an option as well.
Good answer.
We have another question. We have a question from Jocelyn Sproul. Is convalescent plasma being used to treat children with MIS-C? MIS-C?
Yeah, that's a great question, Jocelyn. No, because the problem with the multi-inflammatory syndrome that we're seeing, multi-system inflammatory syndrome in children, is actually an overactive immune system. So remember, we talked about the fact that this syndrome occurs 2 to 6 weeks after the initial infection. So presumably the virus has been cleared by a child's very capable immune system. And this is now the after effects where, for some reason, the immune system goes awry and inflammation is in multiple organs throughout the body. So it's really a matter of toning down the immune system as opposed to supplementing it with plasma, which really only helps to eliminate the virus. And of course, we know in this instance, the virus has already been eliminated from the body.
Okay, Valerie Spalding. I am concerned, Valerie Spalding Parker, I'm sorry. I'm concerned with students on 504 plans and IEPs in which distance learning will not support their accommodations. What can be done for them?
I think maybe we could hear from Dr. King and also Byron on this. So maybe first Dr. King.
So I didn't hear, for whatever reason, I didn't hear the question.
The question had to do with students on 504 plans and IEPs in which distance learning doesn't support the accommodations that are needed. Maybe you can talk briefly about what 504 plans and IEPs are, because not everybody knows, and then what can be done for individuals who have those specific accommodations.
Right. So an IEP is an individual education plan for students who have a disability or special education students, and they're protected by law. And that plan develops what accommodations that they're allowed to have. A 504 is equivalent to that, but it's not mandated by law, but it's for students who might have other health impairments to get accommodations as well. And some examples of those accommodations could be, extra timing on test or the use of a device, a special device that they need. There's a multitude of accommodations that students are given. And to be honest with you, this was the hardest thing for us when we were trying to come back online as school systems, right? How were we going to make sure that we were accommodating and being complicit to the laws of special education for our students? And we still haven't figured it out completely, right? Like because we know that students who need accommodations are at home with their families, who sometimes can't provide those accommodations. So it is a problem. I think nationwide it's a problem, and it's something that we're still addressing. I know in our school system, our special education teachers are doing one-on-one office hours with students to provide extra support to those students on a one-on-one basis when they can. And they are having IEP and 504 meetings, through our Blackboard collaborative sites, just like they would if they were having meetings. But I'm going to be honest with you that this has been very, very difficult for us. And, there are some parents who are very angry because we don't have a playbook for this. But school systems are doing the very best that they can to make sure that they are meeting the needs of all of our students, to include our students with special needs and our students with 504 plans as well. So we're still trying to figure it out.
Dr. King made some good points. This is definitely a challenge for all school districts. I serve as the 504 chair at my respective school. And what I've been reiterating to our teachers is that, we're in a hold harmless state at this point in the game. And all we can do is look at that 504 plan or that IEP, and to the best of our capabilities, ensure that it's executed within the confines of what we're dealing with. But we're still working through that. All I do know is that all of our resource teachers are there and still giving that support, still giving that one-on-one, still doing that small group instruction as indicated in that respective plan. So as we move forward, again, this is new. We're all in a barren land. We did not see this coming. And so we're figuring some of this stuff out as the state gives us guidance as it relates to how we're to, and the federal government, as we are to address these situations. But we are mindful of it, and we're doing everything we can to support those students.
Wonderful. All right. I know it's a tough situation, and basically a lot of people are building the plane as they fly it. So next question.
From Chandra McCulley. Name sounds familiar. What specifically are each of your school districts doing to better equip parents to teach their kids and or assist their kids with distant learning? With distance learning.
So would you like to take that one, Wendy McCulley?
Thank you, Chandra, for that question. We are, as everyone has said on the panel, we are still figuring it out. We have launched resources online for parents by grade level, and also launched recommended other online tools like Khan Academy, for example. We are also supporting parents through hotlines, like with the technology. We're handing out 74,000 laptops and tablets, and things don't work, things break down, parents don't know how to work the app. So we just established a family hotline where parents can call in for guidance. Also, our teachers are reaching out to students every week, and that is also interfacing with the parents to help them. And as I mentioned in our summer reading program, we actively do that. We actually actively hold workshops where we teach the parents how to teach the kids how to read, right? So they can support in addition to the teacher, because it's always that partnership that makes it work with the teacher and the parent and the child.
And Dr. King, would you also like to comment? I think the question was for all three, but I'll just do two in the interest of time, since I know we have other questions.
So our school district launched a wealth of resources for parents, but I think the parents are getting their best learning by attending class when they can with their students, right? They're seeing what the teachers are doing and then emulating that when they're working one-on-one with their kids. But again, we have kids that have tutors that are working with them, and the kids that are home alone because their parents are essential workers and they're leaving. And so we're just asking our parents to do the best that we can. Of course, we've had many, many conversations with parents, talking them off the ledge out of frustration. Frustration because they care about their kids. They want their kids to be successful. And sometimes they're not able to give the help that's needed for their kids. But we're just telling them to give themselves grace, right, through this period, because like Byron said, nobody knew this landmine was coming, and we are doing the best that we can. So, I tell parents, just put some structure in your kids' day to the best that you possibly can. If you're working at home and your kids are, in school, try and, have them doing their schoolwork the same time you're working at home in a close proximity, so that you can pay attention to what they're doing and learn as they're doing it as well. But, we've given lots of resources. We have TV channels that parents can tune into to get some ideas from. And I think it's been working, again, to the best of our ability. But are some people still upset? Yes, because, everybody wants the best for their kids. And again, school systems are doing the very best that they can to ensure that we're meeting the needs of our students in this time.
Yeah, I think patience with everyone and all our systems and institutions is important. And grace.
Right.
Yes. I just want to throw in a commercial for free broadband. I heard Congressman Clyburn this morning mention that it's in a new bill called the HEROES Act that's being passed, and the importance of, especially for rural communities, which I think might apply to Wendy, and also even just having broadband for struggling families that might not be able to afford the kind of broadband that you really need to have good distance education. I'm familiar with it because of telemedicine. The same issues are true. You can't dial in and have a broadband conversation, video chat with your doctor unless you have access to broadband. So I think that's also important to keep in mind. Next question.
We have a question from the West Coast. Again, who do parents contact to help mitigate the disparities in education in lower income communities?
That sounds like a Wendy McCulley question. Potentially.
Thank you, Melissa. I would say you should contact your Board of Education. Your trustees were elected to work for you, and they would be a great starting point. What a lot of people do is they go to the superintendent, but the superintendent takes his or her direction from the board. So they are a great place to start to advocate for your student. And a lot of districts also have a constituent services department where you could go there to advocate for your student. And faith-based communities have a lot of power when it comes to the school system. So your local pastor also.
Wouldn't have thought of that one. Okay. Next question.
We have a question coming from Max Gregory Anderson. College students have returned home, and after being away on their own, what tips are suggested in helping them adjust to coming back to their home and parental control?
So that question sounds, even though we're really dealing with non-college age children, 18 and under, I think the perfect person to answer that is Byron.
Well, shoot, I can relate to that personally. Let me tell you this. I got a call, I think it was March 16th, saying that I need to be picked up on Saturday because they're sending us home. Then I got a call later on that night, Dad, I got to be picked up tomorrow. So I had to drop everything I was doing and go pick him up abruptly. Now, I got a reality check when I got there. I realized that my son was actually living like an adult, meaning that he was doing basically whatever, he wanted to do. He had the freedom of choice. He had to adhere to, of course, the campus rules and expectations, but he was living as an adult. And I had to be mindful of that as he returned to the home. I had to remember that he was operating independently, that he had his own space, that he was getting up when he wanted to, and he was going to bed when he wanted to. He had responsibilities that he had to meet. So that's a give and take when they have to return back into a home where the parents are accustomed to engaging that particular child in an authoritative manner. But there needs to be a shift. And essentially, you have the rules in your home. As long as that individual, your child, is adhering to those rules, meaning curfews, expectations, responsibilities around the house, as long as they're adhering to that, you have to kind of coexist because they are independent. They are young adults. They have been out there. We've charged and given them the autonomy to live independently, and we have to respect that when they return.
Great advice. All right. Next question.
This is from Marv West. Some schools are having summer programs for their students to catch them up since they may have had academic loss. What are your school districts doing?
So I think Wendy addressed that for her school district already. So let's go to Dr. King.
So we're having summer school, and we're focusing on our most neediest kids, right? So teachers are letting us know which kids that are most vulnerable right now. And then just like Wendy said, we're doing some of the same things that they're doing. Their credit recovery for our high school kids to make sure that we keep them on track, and making sure that we're having continued education for our special education students. And then for students who are just not showing up, we're going after them, right? Because we still have students who have not shown up during this distance learning, and we're trying to figure out why and what we can do to make sure that we get those students into summer learning.
Great, thank you. And there was actually a question that I had for Byron. You mentioned that you have 2 summer school sessions. What's the date demarcation for those? You said one is going to be still distance, and then the later one is going to be hybrid.
So the remote learning one begins, I think, is around June 3rd, June 4th. Essentially, that's a continuation of what we've already been doing, but they're for select kids. And our approach to summer school is more for those students that did not meet the mark when we started remote learning. We wanted to go ahead and touch them and get them through that process. We're still formulating what our plan is going to be to help close that gap because we're going to have to be strategic in terms of how we approach that. So we're still in that planning process. The second phase of summer school starts July 6th. And of course, you know, there's still, you know, some ambiguity, some uncertainty as it relates to that hybrid model, and if we're going to be able to execute it, because we don't know what the CDC or the state is going to say as we draw closer to that time. So, but those are the dates for those sessions.
Great, thanks for clarifying that. Any other questions?
We're rolling down to the last questions.
All right.
And we have a question coming from the West Coast for Wendy, of course. Are you aware of programs similar to yours in other states as far as distribution of laptops and et cetera?
I think that most districts around the country are doing some variation on distribution and targeting kids who don't have laptops or computers or mobile hotspots. And I would defer to Dr. King and Dr. Byron.
So I can just say in my district that we were 1-to-1 for all of our high school students this past year, and the school board has voted to go 1-to-1 with all of our middle school students for next year. And then they just voted this past week to ensure that we have a device in the hands of all of our kids next year. So what those devices might look like for the younger kids may be different than a laptop, but maybe, you know, it's a tablet for our pre-K through 2 students versus our 3 through 6 students. But our school system is investing in the technology because we don't know where we're going to be. And one thing that we learned from this issue was that when we left on March 13th, everybody didn't have a device in their hand. And that we had to spend the first 3 weeks making sure that everybody had the device in their hand. We know that now, so we need to spend the summer making sure that we invest the dollars to ensure that if we have to stay with distance learning in the fall or even do a hybrid, that the technology is not going to stop students from engaging in the learning. The next thing will be making sure that we have MiFis, which are hotspots for the families that need them as well.
Yeah, so we're 100%, our district's 100%. Everyone has a device. Of course, at the lower grades, you know, your kindergarten, first and second grade, we didn't allow them to take them home. So we had to put a focus on getting those devices in those kids' hands once this pandemic hit. But we are 100% device for each individual. We did want to say Comcast has provided free internet service for our district.
Wow,
that was a plus.
great.
Yes, that was a plus.
That's great.
And we're now working on those hotspots as well.
Okay, great. I think Comcast is based in Atlanta, isn't it?
I believe so. Yep.
Yeah, that's
That's
great.
nice.
Good for them.
You know, Melissa, if I could share this real quick, that
Sure.
one of the first pictures that one of my principals sent me was of a little girl sitting on the curb of their school using her laptop, sitting on a tray so that she could have access to the internet, right? And that picture stays in my mind every day because, you know, her parents wanted her to learn, so they put her out there. But when it rains, what happens? You know, when the weather is bad, what happens? And it just shows the inequities and the disparities amongst our communities when, you know, kids are given opportunities. So that's something that school systems are definitely going to have to focus if we want to be equitable.
Absolutely.
Final 2 questions here. We have one coming from Lila on the West Coast, and we'll save that question for last. And we have one from Beryl West and Anderson West. And what social emotional health activities do you recommend for summer activities? Many camps have summer activities online. We need to know non-technology options.
Non-technology options.
Yes.
Wow. Well, that's a challenge because here we are in a situation where we're avoiding touch. But what I will say is there are a number of socio-emotional curriculums. And one of the ones I use is Second Step. And it has numerous activities. There are many lessons that you can review with your students or with your campers or with your children. It has a vocabulary. It has scenarios and how to deal with those situations. So I would start there with a strong social emotional learning curriculum. Secondly, a lot of our kids are dealing with emotion dysregulation. and again, anxiety and things of that nature. I strongly encourage parents, educators, anyone that's facilitating activities for students to use mindfulness exercises. There are numerous apps out there. Calm is one that's used that I know is free. Those are things that'll take you through relaxation exercises, meditation, just things to refocus the mind, because we are in times now where, again, it's difficult to stay focused. It's difficult to deal with the uncertainties of what this pandemic has brought to us. So that would be my advice as it relates to that. And then if you could email me at BK and Associates at iCloud.com, I will send you some resources to address that.
Great.
And
Thank you.
if I could just chime in too, I think that, taking your families on walks every day and just
Yes.
exploring nature, exploring what you see, architecture, those are things that, calm students down, families down, and it's a great way for families to do something together and learn.
And it also gets in exercise,
Correct.
which helps to boost the immune system. So,
Correct.
I think we have one more question. Is that right?
The final question for tonight. Can Dr. Clarke restate the 5 self-help practices as a reminder for kids and parents, especially during the summer?
Absolutely. I'd be happy to. Before I do that, I want to mention that Wendy McCulley has an article that she wrote for African-American parents as a resource guide. Is that something that you make available or can make available for people as a resource in general?
Yes, I can. And we also posted it on LinkedIn. So I will talk to you and Wayne and see how we can do that.
All right, great. So the 5 self-health actions. Well, the first has to do with nutrition. Summer is a great time to focus on nutrition because you have the plethora of fruits and vegetables, healthy produce available. Making sure you're getting 5 to 7 servings a day is very key because it has those beautiful colors across the spectrum of the rainbows, greens, reds, purples. And each of those colors helps to decrease inflammation in your system and help to boost your immune system. The second self-health action has to do with staying well hydrated, also important during summer. So 2 liters or more for adults. And you want to make sure that if you're drinking alcohol or coffee, that you're drinking extra. If you're doing physical exercise as well and you're sweating a lot, that you also go above and beyond that. The third has to do with movement. Again, Dr. King mentioned the great thing about getting your family out and walking. The key isn't necessarily exercise, although exercise is great, but just moving your body, not being a couch potato. The fourth has to do with rest and getting enough sleep. So for adults, 7 to 8 hours. For kids, the younger ones need more, so 10 to 14 hours, depending on age. And then adolescents, somewhere in between, around 9 to 10 hours. And so that sleep is really important because, again, it helps. That's during the time during which the body repairs itself. And that actually automatically boosts the immune system. And then last but not least is addressing the levels of stress in your life. Byron mentioned stressors that come at us. That's normal, but it's how you respond to them by not letting them overwhelm you and having some dedicated practice that you do every day, whether it's taking a walk with the family, whether it's playing a musical instrument, whether it's gardening, whether it's yoga, tai chi, meditation, prayer. Any of those helps to reduce your stress level. The key is to do it on a daily basis because stress is one of the most damaging things to the immune system. So those are the 5 self-health actions. They're in my book, Excuse Me, Doctor, I've Got What? And also I just did a YouTube video about them. You can also take a look at that as well, where I go into more in depth into all of them. So I really want to thank each of you. You were fantastic. You are just gems and fountains of wisdom in your respective areas. Thank you, Dr. Nardos King. Thank you, Byron Kellam. Thank you, Wendy McCulley, for being here tonight and sharing with our audience. We will make Wendy's article available, and I'll also ask Byron for his email address. I'll put that again in the comments section so everybody can have a written copy of that as well. So thank you again. And remember, next week, we are going to be going live. Instead of Tuesday, we're going to be back at our regularly scheduled Monday night, 9 p.m. East Coast time. We hope to see you then. Again, bring your questions. And until then, be wise, be well, and be health empowered. Thanks for being here.
Thank you, Wendy. I mean, Melissa.
Thank you.
Thank you.
All right. Thank you too, Wendy.
Yes.
All right. Bye, everyone.
Bye.
Bye.